Depending on where the pathology is within your aorta will determine what type of operation we perform. Sometimes this operation can include repair or replacement of the aortic valve if the pathology involves the root of the aorta where it attaches to the heart. If this is not involved, sometimes we can replace only the middle portion of the aorta between the heart and the branches to the brain. However, when the arch of the aorta, or the portion of the aorta that gives off the branches to the brain, has pathology, either dilation or dissection, we also have to perform surgery on the aortic arch, which sometimes requires incisions either over the right clavicle or sometimes in the groin in order to be able to do the surgery safely. When we're performing surgery on the aorta, depending on which portions require repair or replacement will determine how long the operation takes. But typically, if we have to repair or replace both the root and the arch of the aorta, these operations can take 6 to 8 or sometimes even longer in order to safely perform the repair. It's important to remember as a loved family member or loved one that longer surgery does not necessarily mean a problem. We just want to take our time and take good care of your loved one while we're performing their operation.